Hello everyone, and welcome to this audio podcast as part of this presentation series, this research and presentation series, and this audio podcast as part of a ZtormLabostix production. In this audio podcast today, looking at works from 2012, sort of peer-reviewed and published works, and looking at this works from a from an adaptive sort of perspective. This works on peer reviewed and published works from 2012 is adaptive works from a review looking at how young people with chronic kidney disease, looking at how young people with chronic kidney disease cope, and again, with this works is and was peer reviewed and published works from 2012. So to begin with, just to highlight, there is as part of this sort of overview this presentation, this works. There is a look at the contents. There'll be some intro, some look at aims and objectives, some look at the methodology, um, a look at sort of the analysis, and looking at the themes derived. And then on this contents page, looking at where theme one looks at a lack of coping definition, um, and theme two looks at coping strategies in young people with CKD. Theme three looks at barriers understanding coping in young people with CKD. And then there'll be a look at sort of a discussion, implications for practice, and then conclusion. So a bit of intro or introduction to this works. So evidence indicates that incidence of kidney replacement therapy, or KRT, um, KRT being the abbreviation for kidney replacement therapy in amongst the pediatrics or young people's population had been in around um, had been when the evidence indicated had been around in around between 7 to 8 per million population, and particularly those below the age of 16 years of age. And frequencies have known to, however, fluctuate around sort of higher, from around 55 to 62 per million population. And at the same time, 40 years ago, or at least 40 years ago, or 4 decades ago, even young people with CKD had died. Mobility has improved by the availability of varying treatment modalities. In majority, pediatric renal teams endeavor to identify transplants for recipients, but prognosis is dependent on kidneys being available. At the same time, looking at coping strategies in young people with chronic conditions like CKD are extremely pertinent in the area of clinical medicine. The lasting prognosis rate among young people needing KRT is or has been evidenced is or has been evidenced as around 79% in the first decade, and in around 66% in around the second decade. Despite progress in amongst survival rates and prognoses, young people with CKD and families can be under varying pressures. Now, looking at sort of the aims and objectives. So a literature review had been required to investigate and understand what has been documented surrounding care for young people in the CKD population, but more specifically to investigate documented evidence surrounding coping. So this review, or this literature review, specifically looked to investigate as follows. So number one, sort of the strategies or processes and ways of coping utilized by young people with CKD, and determine what mechanisms or strategies they adapt to cope. Secondly, to identify the main challenges young people with CKD face. Thirdly, to determine and describe whether coping strategies or processes adapted are helpful. And fourthly, to understand what coping with CKD means to young people, to understand what coping with CKD means to young people. And fifth, to identify publications investigating coping in young people over a 34-year duration, at least when this original works was originally sort of formed. So in around the methodology then, so an initial PubMed was PubMed search carried out using was carried out implementing the use of three main terminologies, including coping, pediatrics, and kidney disease. The three main aspects that were initially realized were as thus. Number one, there were only two publications that investigated coping in young people with CKD before 1978. The literature surrounding coping in young people with CKD after 1978 had been insubstantial. And third, the young CKD population was a small one. Now looking at sort of the grouping of terminologies. So as part of this, part of the methodology, as part of the methodology aspect to this works was where there was a grouping of terminologies under three different where terminologies were collated under three main terminology three main terminologies. Again, the main terminologies being coping, renal, and challenges. Those were the three main sort of categories or terminologies. And then under each of the terminologies here in this table, or table one, is where there is a list of terminologies, that are sort of particular and in some way specific to the main terminologies. So, for example, under coping, there's obviously coping. There's well-being, looking at quality of life, resilience, trauma, adapting, accepting adversity, and attitude. Under renal, there's renal failure. There's stage 5. There's chronic. There's kidney. There's disease. There's pediatric. There's nephrology. There's renal replacement therapy. There's transplantation, medication, peritoneal dialysis, hemodialysis, surgery, and healthcare. Under challenges, there's a psychological, physiological, and psychosocial. So now going into the number of publications or papers that would have been identified according to an initial search through through databases, PubMed Central and Medline searches. So under in this table here, in table 2 here, you can see that there you can see in this table there are three main searches, or more in depth sort of searches through PubMed Central and Medline databases. So, for example, there was a basic search, an advanced search, and a refined search. And so, for example, under the coping terminology, there was a combination of coping terminologies that were inserted as listed in table 1, and this retrieved 48 papers or publications between 1978 and 2012. And then in under renal, and a basic search, a combination of renal terminologies were inserted as listed in table 1 again, and this retrieved 24 papers or publications between 1989 and 2012. And then under challenges, a basic search retrieved a basic search informed a combination of there was a combination of, again, challenges terminologies, and a combination of challenges terminologies inserted into the search engines, into the PubMed and Medline search engines as listed in table 1, and this retrieved 291 papers or publications between 1975 and 2012. And then in amongst an advanced search, you can see here in this table that again, sort of inserting the terminologies from table 1. This under the category, or under the grouping of terminologies for coping, this retrieved 28 papers between 1976 and 2012. In the advanced search, inserting all the terminologies from table 1 again, this retrieved 24 papers between 1989 and 2012. So in a way, you can see here, listeners and viewers, that the terminologies, or the grouping of terminologies in the basic search under coping, and the basic search under coping, and the basic search under renal sort of grouping of terminologies, the number of publications or papers were not so dissimilar. And then under challenges, under the challenges for the advanced search, inserting all the terminologies from table 1, this retrieved 388 papers or publications between 1975 and 2012. So in an advanced search, more papers, more publications or papers have been identified in the advanced search. Then thirdly, as part of identifying publications according to coping, renal, and challenges terminologies, or grouping of terminologies. In a refined search, you can see there in this table there is a look at a refined search allowed additional specifics to be added into PubMed Central and Medline searches. So, for example, in ensuring, for example, that papers or publications were specific to a population, a refined search allowed a look at papers or publication in regard to in regard to the pediatric population age 6 to 12 years, and then adolescents age 13 to 18 years, and then also where all terminology could be added into the search. Additionally, with a refined search, looking at papers and publications published in the English language amongst the human population, and also publications or papers that included full titles for publications, titles for publication and abstracts. And then additionally, Medline and PubMed subsets were also marked. And in the first in amongst the coping category, for example, this the initial a refined search had a refined search and investigation retrieved 20 papers between 1976 and 2012. Refined search under renal retrieved and using the same sort of refined search aspects, retrieved 22 papers between 1989 and 2012, and then a refined search under the challenges grouping of terminologies, retrieved 20 papers or publications between 1989 and 2012. So, having identified an initial number of works through PubMed and Medline, several databases were then also sort of additionally accessed through EBSCOhost databases to also identify papers or publication over a 34-year duration. Databases included Signal Plus with full text review, psychology and behavioral science collection, SciInfo, Health Source, Nursing Academic Edition, International Bibliography of the Social Sciences. Smart texting searching. Smart texting searching was also implemented, where smart texting option was or is used, replacing the and or methodology, at least in context of EBSCOhost, since EBSCOhost databases works differently to PubMed or Medline databases. And at the same time, smart texting through EBSCOhost allows as much text to be entered for searches to identify papers that are most specific or most particular around where investigators look to identify publications around particular specialties, or around particular aims or objectives or themes. And then additionally, a basic coding process was also used to ensure that terminologies were related to those categories as outlined in table 3. Sorry, in table in table 2, as outlined in table 2, but also where now, as part of the methodology, where table 3 now, this was where there was an explicit grouping of terminologies. So explicit grouping of terminology. So in addition to for example, in addition to in addition to the basis of the context in table 2, in this table, the explicit grouping of terminologies where the options were selected for full text, peer-reviewed journals, periodicals, abstracts, whether abstracts were available again in the English language, and also looking at the population group, meaning population group being human or human beings, since there have been publications before that have been published in amongst in amongst other species when looking at when looking through the databases. So in this table, or table 3, the explicit grouping of terminologies, it looks at young people and coping, young people and renal, young people and challenges. And so in for example, the young people and coping, there was the terminologies the explicit grouping of terminologies again included pediatrics, or young people between ages 6 years to 12 years, adolescents ages 13 to 18 years, and then looking at publications that were in regard to coping and quality of life and mental health at the time. And in the young people and renal included a pediatrics or child population between 6 to 12 years, and looking at adolescents between 13 to 18 years and chronic disease. And then young people and challenges, looking at the pediatrics and child population between 6 to 12 years, and the adolescents a population between 13 to 18 years, and terminologies specifically around psychosocial and psychological. So in around the analysis then, in around the analysis, so using a critical appraisal skills program, or CASP, papers or publications were then initially classified on a type classified based on a type of investigation. So for example, whether a publication or paper was qualitative, quantitative, whether it was a systematic review, whether it was a randomized control trial, an interventional public interventional works, cohort investigations, case controlled and diagnostic and or a diagnostic test investigation. And so out of one once the CSP once the critical appraisal skills program was utilized, 337 abstracts went under a 10-question screening process. And so the CASP, the critical appraisal skills program, helped analyze in the following manner. So number one, is the study valid, or does the study have validity? Secondly, what were the results? What were the results? And thirdly, will the results help locally? Will the results help locally? So the CASP 10-question screening process is also designed, or was also designed, to help think about issues systematically. Several prompts are given after each question, and these are designed for investigators. These are designed for investigators to look back at why aims and objectives in around a particular works are important. So, in addition, as part of the analysis, then 141 abstracts had been identified through PubMed or Medline search. 196 abstracts were identified through EBSCO host databases, and so after removal of duplicates, 274 abstracts were subjected to inclusion and exclusion criteria as informed in table 3, and 63 papers or publications were then evaluated, which helped to derive three main themes. Number one, theme 1, lack of coping definition in young people. Theme 2, coping strategies in young people with CKD. And 3, barriers to the understanding of coping in young people with CKD. So now looking at theme one, so lack of coping definition in CKD. So coping is an influential intermediary of expressive consequences. Encouraging outcomes are related to coping strategies, and undesirable outcomes are related to negative coping. In works by Folkman going back to around 2008, informed that optimistic feelings are a normal element of coping strategies, and these support psychological coping. So, for example, young people who are well, proficient, and positive are capable, and so less exposed toward the stresses in time. And this has been emphasized by work. This has been emphasized also in this was as well also documented or evidenced in works by Schwarzer Schwarzer in around in around the late 90s. And a second definition developed in joint effort by Lazarus and Faulkner, who asserted coping can be problem focused, coping or emotion focused. Co- sorry, who asserted that coping can be problem focused, and also can be emotion focused. Problem focused coping involves strategies that attempt to ease or eradicate challenging circumstances. Emotion focused coping involves approaches to smooth emotive or possibly challenging events. Coping also depends on appraising whether whatever can be carried through appraising whether where or appraising where there is a challenge, where challenges exist can be modified. Uh, if a challenging situation can be approached to ease a circumstance, problem focused coping dominates. Otherwise, in challenging situations, emotion focused coping predominates. And strides have increasingly been made to assess coping in young people with chronic illnesses such as CKD, and young people also tend to have own modalities. In around the second, looking at the second theme, coping strategies in young people, coping strategies in young people with CKD. So for young people with CKD, coping can mean a lifetime of ailment. The range of psychosocial concerns that young people with CKD and families contend with has been documented in works going as go, in retrospective works from Korsch and team in the early 1970s, and works by Postlethwaite in around the late 1980s, and also Reynolds and team in the late 1980s as well. Young people with CKD differ from young people with other illnesses in that this illness requires a lifetime of varying pharmacotherapies, and even after transplantation, coping may either may take coping may take either a positive or negative form. And when disease is intricate like CKD, denial has also been identified as a typical attitude, and anxiety is also common. Coping strategies adapted appear to be related to traumatic experiences. Letting healthcare professionals know what is challenges, what is letting healthcare professionals know what is challenging for them is and has been documented in works by Jasselon in the late 19 in the late noughties, and at the same time, humor has been found to be quite an important positive coping strategy in young people with chronic illnesses. Looking at theme three and barriers understanding coping in young people with CKD. So assessment of coping poses unique problems in young people with CKD. Young people may interpret differently to adults and have perspectives regarding disease. In addition, aptitudes to inform using quantitative data works may be affected by development. And so, what this means, listeners and viewers, is that those where investigations historically have involved have investigators looking to understand the sort of challenges in around sort of quality of life, for example, or health related quality of life in young people, and where primarily investigators and researchers use quantitative modalities or methodologies to collect data to understand and accept that in works by Isa and Morse in the early millennia had informed that aptitudes to inform using quantitative data works can be effective because of the way that young people with CKD develop in context of their cognition, where cognition can be affected in young people who are diagnosed. And then traditionally in both clinical and research works, the assumption that adults can answer for people answer for young people has gone unchallenged. However, young people may have exclusive viewpoint on coping, which may be influenced surrounding, for example, dreams and plus aspirations. At the same time, one investigation had highlighted that young people on peritoneal dialysis are more likely to show self-reliance and further probable to cultivate bonds than those on hemodialysis, and this may be because there is less restriction on this form of KRT. So now now looking at this in as part of a discussion. So a chronic illness not only affects the young person or young people, but family members also. Each chronic ailment encompasses diverse challenges, and it is probable that different measures are required to effectively assess various aspects of a disease, of a disease or condition. And there are several publications or papers that give further insight on assessing, for example, quality of life, aspects of quality of life in young people. Unfortunately, information surrounding coping to support young people with CKD pre and post transplant has not been investigated in detail. Coping for young people can include managing symptoms or symptomologies, understanding invasive KRTs, tolerating everyday pharmacotherapies, dealing with restrictions, and attending hospitals for appointments. For example, quality of life is more of a broader concept encompassing a variety of dimensions, whereas coping is thought to be more specific. It is important to highlight that current research works involving young people with CKD, especially the CKD severity 4 and 5, has been limited or insubstantial. Much of the research conducted surrounding young people with CKD involves assessing quality of life and assessing quality of life, and where investigators again use 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 quantitative modalities to collect data to understand or attempt to understand coping, or attempt to understand similar aspects to coping in young people with CKD. So, in context of implications for practice, then, so research is still required to understand actual perspectives from the pediatric or young CKD population, and there needs to be more collaborative efforts, including the development of a formal coping framework for CKD for the CKD pediatric and young population, and a framework should be an inherent part of a patient's care plan. And so, as part of a conclusion, then, so this review elaborates that research investigating coping in young people with CKD has been an under-researched area, with only one single publication or paper investigating or exploring, at least at the time. So that where this works again is from it was from in around 2012, in around 2012, and at the time inspecting inspecting experiences in regard to transition or pediatrics transition to adult services to where pediatrics transition from pediatric renal care to adult renal services, and not so much where investigations have delved into looking at coping. That draws this presentation, this audio podcast to a close. This audio podcast is part of a research and presentation series. This audio podcast as part of a ZtormLabostix production.